Hello and welcome back to Heer Now. We're talking about diabetes and our eyes. And we're joined by guest Dr. Richard Maharaj from eyeLABS Clinic. Thanks for being here and thanks for talking about diabetes. Before the break we were talking in general about diabetes and some of the types of diabetes and why it's such a big factor in Peel region. You said that Brampton is amongst the highest in all of Ontario.
Yeah, in years recent, we've looked at different areas of the province, and Central West, including Brampton, Peel region, etc., has amongst the highest numbers in terms of prevalence and incidence of diabetes in the province. Interestingly, with that number, you would expect there to be higher usage of eye exams, but in fact, diabetic or retinal eye exams have been some of the lowest in the province. So there's a disproportionate number there, and so I think it's important for our patients to know, or for our viewers to know that we can do a better job of that. So yeah, it's pretty astounding.
It's pretty scary. And do you think that there's enough awareness out there when it comes to heart and stroke and Canadian Diabetes Association and maybe Peel Region Public Health and our doctors? Like, are we talking enough about it?
I think we're talking a lot about it. I just think that we're talking a lot about the wrong things. To be quite honest, I mean, I think there's a strong branding. Everybody recognizes the Heart and Stroke Foundation and the lottery and all the things that go along with it. But, you know, when it comes to peer-to-peer or doctor-to-patient, that's really where the communication really needs to be enhanced. You know, global campaigns from different diabetic associations, yes, it's important that it gets out there. But what does the patient really need to know? And that's where signs and symptoms are really important. And I think that's where we can do a much better job, to be quite honest. And when I look at systems in different countries, like the UK, we were talking about that between you and I. In the UK, they have a national program for diabetic eye screening, which is mandatory. You get diagnosed with diabetes and you get enrolled in the program. We don't have a national program or even a provincial program like that in Ontario, which I think is a travesty. I think we can do a lot better. So I think our patients deserve it. Because
considering our high numbers, I mean, you know, 9 million.
And considering it's preventable.
Yeah.
You know, that's the biggest thing here. It's preventable.
Well, my spiritual leader said that if you want to get rid of diabetes, you walk 1,000 steps a day.
That's a good idea.
And I think, you know, and he's of the firm belief that you can totally be rid of diabetes if you just walked.
Yeah. Yeah, physical activity is a big, I mean, obesity is one of those. We look at these three things, right? Your fasting sugar, obviously, your A1C, which is the blood test that your doctor would do, and then it's your waistline. It's a very simple equation here. Do some exercise, get your waistline down, and that's actually a risk factor that you can reduce. So that in and of itself is important.
Are there any other signs or symptoms, you know, other than what you already mentioned?
So yeah, so other than the obesity and your sort of your general weight and your body mass index, we talked a little bit about it earlier, but from a visual perspective, there are certain symptoms that I always tell patients to look for. Number one being fluctuating vision during the day, right? So you wake up in the morning. If you're a person that wears glasses, you put those glasses on, they should work for you the entire day, right? Because they're plastic, the lenses don't change. So if at some point in the day, after a meal or before a meal, or when you're getting tired, or if you're hungry, if the vision starts to change, or if you're just finding that there's hours throughout the day where it's not as good or better than others, then that could be a symptom. Another symptom could be dry and irritated eyes. If you're constantly dehydrated, you have that sort of dry mouth and dry eye, that can sometimes be one of the signs. Sometimes floaters in your vision can also bring that about too. So there's actually several signs. But what's scary, and we use that word scary, and in fact it is very scary, is that in the early stages of diabetes, there can be no signs. The fluctuating vision isn't there. You know, patients with type 2 diabetes, 20%, so 1 in 5 new diagnoses are already experiencing diabetic retinopathy, which is bleeding in the back of the eye. So they don't even know it.
That's scary.
Yeah.